Thailand has confirmed its first case of the highly dangerous Clade 1 variant of Mpox, raising significant concerns for global health authorities. The patient, a 66-year-old European man, arrived from an unnamed African country on August 14th and tested positive for Clade 1 after seeking medical attention the following day. This variant is known for its higher fatality rate and greater transmissibility compared to the more common Clade 2 variant that spread globally in 2022. The man had limited contact with others, and Thai authorities have placed 43 people under observation who may have been exposed to the virus. With final lab results now confirming the variant, this marks the first known case of Clade 1 in Thailand. Mpox, formerly known as monkeypox, is a viral disease with two distinct clades, Clade 1 and Clade 2. Clade 1, primarily found in certain African regions, is significantly more dangerous than Clade 2, with mortality rates reported as high as 10 to 15%. The confirmation of Clade 1 Mpox outside its endemic regions raises the spectre of a more severe global health threat. The World Health Organization recently declared a public health emergency due to an emerging outbreak of Mpox in several African countries. The spread of Clade 1 to Thailand represents a serious escalation, prompting Thai authorities to increase screenings at international airports and ports, particularly for travelers from Africa. The European patient remains in quarantine, and efforts to prevent the further spread of Clade 1 are underway. A global pandemic involving Clade 1 Mpox would present a unique set of challenges, distinct from those posed by the COVID-19 pandemic. Clade 1 Mpox spreads through close contact with bodily fluids, skin lesions, and prolonged face-to-face interactions. The most concerning aspect of a Clade 1 pandemic would be its severity. With mortality rates as high as 10 to 15%, Clade 1 is far deadlier than Clade 2 and could cause a substantial number of deaths if it were to spread globally. Patients with Clade 1 Mpox can suffer from severe complications, including pneumonia, sepsis, encephalitis, and long-lasting skin lesions, with vulnerable populations, such as immunocompromised individuals, children, and pregnant women, at particularly high risk. A Clade 1 Mpox pandemic could overwhelm healthcare systems, particularly in regions with limited resources. The severe nature of the virus would necessitate widespread hospitalization, isolation of infected individuals, and intensive medical interventions to manage complications. The need for quarantining patients with Clade 1 Mpox would also require special containment facilities to prevent hospital-acquired infections, placing additional pressure on already strained health infrastructure. However, a key advantage in fighting Clade 1 Mpox is the availability of effective vaccines such as the smallpox vaccine, which also works against Mpox. While this pre-existing vaccine could be deployed rapidly, global supplies are limited and large-scale vaccination campaigns would be needed, particularly for high-risk groups. Quarantine, contact tracing, and isolation of cases would be essential in containing outbreaks. A Clade 1 pandemic could lead to significant social and economic disruption, particularly in countries with high numbers of cases. Travel restrictions, quarantines, and targeted lockdowns might be necessary to contain the virus, especially in regions experiencing severe outbreaks. The potential for fatalities and severe illness would likely cause widespread fear and behavioral changes, affecting productivity and public life. The confirmation of a Clade 1 Mpox case in Thailand raises the stakes for global health officials, as this variant poses a far greater threat than Clade 2 due to its higher mortality rate and potential for severe complications. While Clade 1 is less likely to spread as rapidly as COVID-19, its severity could overwhelm healthcare systems and result in high death tolls if not contained effectively. Vaccines and targeted public health interventions will be key to mitigating its spread. But the emergence of this variant outside of Africa signals that global vigilance is crucial in preventing a Clade 1 pandemic from becoming the next major health crisis. To stay updated on the latest health and science news, subscribe to Breaking Through News on the Newsbreak app or at breakingthrough.com.